Hello everyone. I hope you're doing well. It's Rachel, the dental hygienist. I wanted to do a quick video just to say hi. Thank you. We're almost at 500 subscribers, so thank you very, very much for subscribing. I wanted to just do a little video today about some of the things that we have here in the dental office, specifically for our dental hygiene practice. So I won't be going over a lot of drills or anything that you normally would expect in a dental office. It's going to be mainly cleaning items. It's going to be saliva ejectors and the tips and all that kind of stuff, and just kind of listening to some of the sounds of a dental office. So, and by the way, I love all of the video ideas that everyone comes up with. It's great. I have a specific reason why I started this channel. It's mainly to help those that have difficulty with dental appointments. Maybe hard to believe, but some people even have difficulty with dental cleanings. So that's why I like to make sure I am catering to people that will be able to tolerate dental sounds, and just to help ease the anxiety that comes with dental appointments. So I don't normally, or I will not be focusing any sounds around high-pitched drills, things like that. You may find that on other channels. So, but there's a reason why I don't do the high-speed drills, and that's just because I want you all to feel comfortable in the dental visits that you come to, and specifically for the dental hygiene visits. I just want to make sure that you're comfortable. That's my main priority. So I'm gonna go ahead and get started just by putting on my gloves. And I have my pink ones today. These. And actually, before I put on the other one, I'm gonna zoom in a little bit so that you guys can see over here a little bit better. Okay, so these are some of the things that we have here in the dental office, as you can see. So I'm going to be starting off with some instruments that we have. So I just want you to kind of hear. This is the one thing I love about work, is that I get to listen to these beautiful sounds all day. I actually really love the sounds of the crinkle of the paper and of the plastic. And of course of the instruments as well. Some of the instruments we have here. This is a mirror, obviously, so we use this to retract patients' cheeks. We use it to be able to see on the surfaces of the teeth, and we're also also able to do reflection with the light. So we use this for quite a lot of things, mostly for retraction and looking at our surroundings, at the teeth. Next one is the Explorer. So this is specifically an 11-12. It's a certain number. There's different types of Explorers. There's a shepherd hook one, which I don't have in the setup, but that one does not have this double bend at the end. It just has the one and it hooks over. That one's great for detecting cavities, which would be great for a dentist. Being a dental hygienist, we normally like to use these because we're able to get in between the teeth. See, I do have a Typodont. So we have our little Typodont here. We can call them maybe gummy gill. So when we are feeling around for any calculus, we're going to be going up where the gums are and just kind of feeling up around that area and then coming back around. Just kind of using these little exploratory strokes. So if you can see, we actually go in pretty deep. I don't know if you can see where the gums are here. Not sure if that's going to be good, if you're going to be able to see it. But we go all the way up into the gums here, wherever the bone is. If the bone's up pretty high, then we're going to have to go all the way up to where the bone is, so we can feel for any calculus. Okay, and on this one, I feel a little bit right over here. You can feel that it's not nice and smooth. So whenever we feel that underneath the gums, we have to go back in and hand scale. And I'll show you in a little bit what that looks like. We also use this to be able to check to see if there's any cavities. So we check to make sure that there's no sticky areas. So we just go ahead and feel, especially around these little grooves. If you see these grooves, they are very prone to getting food stuck in them. So this is where food debris grows, then bacteria starts eating all of the food that we're eating, and their byproduct is going to be acid, and acid is what causes the cavities. So this is why it's really important that when you're brushing, you're making sure to get all those little grooves, as well as all the surfaces of the teeth. The sides, the inside, the outside, all of those areas. Okay. So I will show you what it looks like when we are probing. So the probing, we have a probe here, and the probe has measurements. So this first measurement here is 3 millimeters. Then we have 6 millimeters, 9 millimeters, and 12 millimeters. Typically, healthy gum is going to be between 1 to 3 millimeters. That's what we want. So when we go to check the gums, we're going right up against the side of the tooth, and we're hoping that we're getting only 3 millimeters in. And we normally walk it around the side. So 3, 2, 3. If you have a really deep pocket somewhere, our instrument is going to go all the way in. So that one would be like, that there would be about an 11 millimeters. Okay. So a tooth like that, if it was 11 millimeters all around, this tooth would be very, very loose because there's no bone there to hold it in place. So that's why it's really important that we're checking these measurements, because if you start off with just 5 millimeters, that means there's inflammation, and your body doesn't like the inflammation. It wants to get it out. It wants to go away from that source of infection. So over time, it's going to go deeper and deeper because you're losing more and more bone. So we eventually get to the point where we have a very deep pocket.
fall out. So, and then you look like that. And nobody wants that. So, one of the best ways to keep from this infection occurring is to make sure that you're brushing and flossing, because you have to make sure you're getting in between as well as the front surfaces of the teeth. In some cases, you may also need to have a very small brush. I have a little brush. It's called an interproximal brush, and you can use it to clean in between the teeth if you have gaps in between your teeth. That's a good way to be able to get in, clean those surfaces. Okay? And of course, coming in regularly to your dental office, getting your cleanings done and your checkups. And every time we see you, or at least once a year, we should be taking measurements. And if you have a hygienist or a dentist that has completed the numbers they start on your cleaning, make sure that you ask them what your numbers were. Most likely, if they didn't tell you, then you should be fine. Maybe 2-3 millimeters. You may have a few 4s. But it's always good to know if there's any particular spots that you need to watch out for. Because if it's something like a 4 millimeter one time, the next time you come back in, it could be a 5, and it could grow to be a 6. So it's really important to make sure that we're keeping up with those pockets. Okay. So the next instrument I'm going to grab, this is a scaler. This one is an anterior scaler. So this one is great for getting in between these areas in the front of the teeth. So we have all these front areas we can get to there, and then also the inside as well. So we scale from the inside and the outside. Okay. Just making sure that we're getting all these surfaces really well. Mainly in the front, we use this, and then sometimes we'll also use it in the back on occasion. I know I've used it before in the back, but not as commonly. If there's a really tight little piece of calculus over here, I'll go back in and I'll just make sure that I clean it off. But generally it's in the front. So for the bottom over here, we'll make sure that we scale really well all these areas in the front. So we usually do it from one side, and then we come back around, and then we do it from the other side. At least that's what I do. Some hygienists probably go this way and then are able to do it that way. I find that my hands don't like it that way. It's the way that I learned in hygiene school, which is this way. And then we turn around and then do it that way. Okay, so now we're going to go on to the other scaler. Okay. This one is a 3-4. So for this one, we would use the scaler on the side. Now this one is a universal curette. So with this one, we can go ahead and start from what we call the distal. This is the back portion over here. This is the distal of the tooth. This is the mesial of the tooth. So we would just scale around the back side and then come to the front. And usually we don't go under the gums in this area. The reason why is because we have two sides to the scaler. We have this side and we have the other side. And if we're going in there, going underneath the gums with scalers on both sides, it is going to cause discomfort for the patient, and also it's going to be tearing up the tissue. That's the reason why it causes the discomfort. So for this one, we typically will just use it on what we call the supragingival surfaces. Supragingival refers to above the gum line. Subgingival refers to below the gum line, so under the gum line here. Okay. So a lot of instruments we can only use above the gum line. If we start using instruments that go under the gum line, they're going to have only one active surface. Okay. So this one also is a universal curette. This one's just a little smaller. That one was made for the very back. This one is made for these little premolars here. That's what they're specifically designed for, or for smaller teeth. So, and typically when we're using this, we're going this way, doing from both the outside and the inside, scaling all that off. So when you go to your dental office, they should be having some of these scalers, at least a minute of scaling. Some offices unfortunately don't. Sometimes they just use these little guys, which is an ultrasonic scaler. This one is sterilized, as you can see, it's in the package. So with these sterilizers, we make sure that the color coding is dark over here. This means it's been steam processed. And this is the internal, there's an internal and an external indicator. So we have external ones on the outside and internal ones. So we want to see both of these. So this one is good. So typically we'll use this one, we insert it in here. Insert it in here, and that goes into a machine, and we'll use that to go through and clean all around the teeth here. I'm not going to take it out because then I have to go back and re-sterilize it again. So I'll leave that one be. But that's kind of what these look like. This is what we call a cavitron. So this uses ultrasonic vibrations in order to remove the calculus off of the teeth. We also use it for whitening, and that's mainly just to help warm the gel to make it activate. So, and it just makes the whitening process go a little faster. So, but we use this for a lot, and if you can see, it has this little shield here. And that's mainly to protect the person that is delivering the service, so the provider or the assistant. If they're working on an area, they can go ahead and block out the light. So if you can see, it's like that, so you can't really see it that much. This way, you would see the light. So that's what that's for. So it's really convenient. And then we also have our air water syringe. So our air water syringe spits out water, obviously, and then also air. Sometimes we need air in order to really dry off a tooth so that we can see if there's any calculus left behind. We can see if there's any potential cavities. So much easier to see if the tooth is dry rather than having a lot of saliva. So we dry it and then go ahead and do our treatment. And then of course we have water. So the water that comes out. And then this one has both air and water. Kind of comes out rather than a stream. Made a little bit of a mess. So it comes out like that. And of course we have the saliva ejector. So we use that in order to suction up saliva. We also have a high-speed evacuation as well. And that one is used whenever we are using things that generate aerosols, typically.
mostly what we use in hygiene. Obviously we have polishing paste and all that kind of stuff, but those don't make as much cool sounds. So, so I hope you like this video. Hopefully you're able to relax and learn a little bit of information about dentistry. So if you have any questions, just leave me a comment below and I will try to get back to you. Okay. Always take care of yourself, brush, floss, and see your dentist at least twice a year. Thank you so much. Bye.